Princess there.
Already falling.
Okay, welcome everyone. Thank you so much for joining us today. We are going to get started here in about 1 minute. All right, thanks so much for joining us today. We're going to go ahead and get started here. I'm Chelsea Treseder with Pivot Hearing, and I want to thank you for joining us today. What we're going to be talking about is humanitarian audiology, and we are really excited to bring this topic to you today. Before we get going, just a little bit of housekeeping here. We are going to leave time at the end of today's presentation for questions. So if you have any questions as we go throughout the presentation today, you can go ahead and put those in the Q&A box that you should see at the bottom of your Zoom interface. And like I said, we will leave plenty of time for those at the end. So with that, I am actually going to introduce Jim Thorpe. He is the Director of Give Back for Entheos Audiology Cooperative. Thanks, Jim.
Well, thank you, Chelsea. Good afternoon, everybody. As Chelsea said, my name is Jim Thorpe. I'm the Director of Give Back and In-House Counsel with Entheos. But more importantly, and for what we're here today for, I'm the Secretary to the Board of Directors at Hearing the Call, and I'm actively involved in helping carry out the mission of Hearing the Call. But before I tell you a little bit more about the mission and what we do, I'd like to share a video with you about how our year in 2023 went, and I'll give you a little bit of an idea about Hearing the Call.
I get you clear.
Oh, that's good.
It's weird, but also very emotional.
Hello. Are you live?
Which is why we flew to Mexico to help 200 deaf people.
Wonderful. So what you just saw is a video about a lot of volunteer audiologists from around the United States and world helping out on humanitarian trips where Hearing the Call is bringing hearing healthcare to different communities around the world. And what is Hearing the Call? What are we about? Well, Hearing the Call is a 501c3 qualified charitable organization. And let me go ahead and share my screen again. Go. And so Hearing the Call is a qualified charitable 501c3 organization. And what that means is it's able to offer tax-deductible charitable receipts for donors that want their donations to go towards bringing hearing healthcare to people both in the United States and around the world. Hearing the Call itself has been around for 8 years, founded in 2016 by Nora Stewart. Since the beginning, we've served over 13,500 people around the world in 13 countries. And we also bring these services to 19 different states in the United States so that we can help support and eliminate the financial gap for patients. Because at Hearing the Call, one of the goals is to ensure that everyone is given the opportunity for dignified, qualified hearing healthcare. So, giving you an idea about what things look like on the international humanitarian trips, we're here to tell you about these today because these humanitarian trips are open to everyone. So, if you're an audiologist and this is something that's already speaking to you, that's what we're here to share with you today, to talk about volunteering in a foreign country, to talk about getting out of your comfort zone and joining a team of like-minded people who want to do exactly what you want to do. These teams travel, as you saw in the video, to various countries around the world. The trips take place over a 7-day period, and we have quite a bit more to tell you today. So next, I would like to actually introduce someone who's going to tell you a little about what it's like to go on a trip, to tell you how her life has changed. And this person is very important to me because this also changed my life. So this is my mother, Mary Thorpe, who is the former president of the board of directors at Entheos and has been on a very large number of humanitarian trips. And we invite her now to share with you about how humanitarian trips have changed her life. Mary Thorpe.
Thank you, Jim. And it's great to see all of you here. I'm a big advocate for Hearing the Call, not only locally, but internationally. And it is with gratitude for all the many, many international trips that I've been able to go on through Hearing the Call and how it's changed my life. So I'll just speak briefly that it opens the doors to wider views that people all around the world are exactly like you and me. They have the same hopes and desires and needs. They're no different than your neighbor. So it kind of gets you off your own block, if you know what I mean. It gives you more worldly views and understanding rather than just knowing what's going on in your area. And so I think that helps to teach compassion and understanding in so many ways that I probably would not have had if I had never had the opportunity to be with Princess in Zambia, or to be in Guatemala, or to be in Tanzania, just to name a few that I've been to. And I have to tell you, I'm so grateful for Hearing the Call and having these experiences. And I feel it's just as rewarding for me, if not more, than it is for the patients that we see. It's something that we actually get to use the skills and the knowledge and expertise that we have to help people all around the world. And there's just nothing better than that, besides the fact that you get to go with really incredible audiologists. So you really bond with people around the country here in the US, which is great for connections and for future. And it's just, I can't say enough good things about it. If you all are interested in it, you really should look into it, because if you get a chance to be with Princess, you all should take it. So if you have any questions for me, please feel free to ask, but I'm going to turn it back over to you. I just want to really reinforce that it's really an awesome experience. Thank you.
Oh, thank you, Mary, Mom. And as you can see and imagine that this type of opportunity has changed my life. My background as an attorney was not audiology, so it's certainly reshaped the things that have come into my life, and it's just been a wonderful opportunity. Now, if you're thinking how do these trips work, well, we're going to give you sign-up information later in this meeting. These trips are open to everyone. As I said, they are 7 days long, and more importantly, when it comes to audiology, we bring best practices where we go on these trips. We bring an entire clinic in about 5 to 6 suitcases, walking into a place where sometimes it only has one plug, but we will manage and we will set up a clinic and take care of what we can take care of. And to tell you more about humanitarian audiology and how it's changed her country and her partnership, how it's changed our direction and outlook, our very strong partnership, I have the pleasure of introducing to you the Honorable Princess Kasune. Princess is the majority whip in the Parliament of Zambia. and she's been a partner of Entheos in hearing the call since the very beginning. But I don't want to spoil any more because I'd like you to hear it right from her. So please, ladies and gentlemen, this is Princess Kasune Zulu.
Hi, everyone. I hope you can hear me. It is a blessing to be here with you and just to share a little bit of why it is so important for those of you that can manage to join in and to visit some of our countries through hearing the call. I just want to thank Jim, your mother, Dr. Mary Thorpe, whom I have known on the different trips, and just many other Marys out there, many other audiologist doctors out there who would have not been available to the people of Zambia, and in particular, a rural constituency that I represent, and now as a minister of a province, so like a senator of a state. That's my new position now. So I represent about 11 districts and 15 constituencies. So that is like maybe representing Illinois or Indiana. And so that is called a minister of a province. And I'm one of the 10 ministers in Zambia. This is an appointment that came from His Excellency, the President, hardly 5 months ago. But I can tell you that one of the reasons why I believe that I've even ascended to different positions in the Zambian government, it's because of the acknowledgement of some of the humanitarian interventions and partnerships, such as hearing the call, that I was able to bring to my country, to my home village, as well as indeed the entire area, which is about 300,000 people, a little bit over. How did it all start? I met Nora and her husband 10 years ago in Fort Wayne, Indiana. I was speaking at a church where they were talking about the plight of the Palestinians and how Americans can be mindful of both the Israeli needs as well as the Palestinian needs. And there I was invited to speak on the needs of the orphans and vulnerable children, and especially people affected of HIV and AIDS. This is 10 years ago. If some of you may know Reverend Mitri or Dr. Mitri from Palestine. And there we struck a conversation between Nora, myself, and Ken, which started a journey to go to Zambia. In that first year, all we did was to show the need of Zambia. You can imagine, we are a people of about 18 million now, maybe you can argue 20 million, but there was only one audiologist in the entire country. One audiologist for about 20 million people. Imagine that great need. And that one audiologist is situated in the capital city of Zambia, which is in Lusaka. So the need cannot be overemphasized, and how, because of such partnership as hearing the call, has helped especially school-going children. Many of the school-going children that I've been able to witness as the hearing the call team comes, they may have just wax in the ears, for example. They may have things that went in their ears, like a stick. But because of lack of the basic health services, especially as it relates to hearing problems, which is seen as more of a luxury compared to, say, treating malaria or headaches or fevers, you find that these children's lives were not only impacted in terms of their performance in school, but their whole entire future is impacted, because if they cannot hear well, then they cannot learn well. Sometimes some of these children, maybe bullying is a strong word, but they are undermined, they are sidelined, in some cases, maybe even stigmatized because they cannot hear well. Yet, if given an opportunity by people like you coming alongside us in Zambia and in many other countries now where hearing the call is, you will find that some of these children are some of the smartest children who actually will change the trajectory of my country. Maybe some will even become presidents of my country or members of parliament, like I have been able to. Why? Because I was given a chance somewhere along the way to go to school. So for me, hearing the call is not only coming to see the need of the people in Africa, but it is coming to give hope where there has been no hope. It is changing the future of these children from being vulnerable to becoming children who can fulfill their full potential, especially as it relates to education. This is why I have become a disciple myself of hearing the call. It is why I believe that these partnerships are so critical. We in Zambia, we cannot do it because we are still struggling when it comes to audiologists and hearing services. But having people like you taking off your busy schedule and your time and your money to say you care enough, not only for the people here in America, but also for the people far beyond, over the oceans and the seas, to arrive in Zambia, a landlocked country, which sometimes has not been heard about because we have been privileged by God's grace. It's one of the most peaceful countries you will find in the world, actually. It rates very high on the peace index. And yet that good news sometimes has not allowed us to be on the world map. You will find some of the most welcoming people in Zambia. But also in the midst of their challenges, in the midst of our challenges, you also have, which I always try to push, if you can see the Victoria Falls, which is one of the 7 wonders of the world, if you can visit some of our parks, in Kafue National Park, for example, you will see the big 5 animals just as a small token of saying, thank you for coming. Because of the coming of hearing the call, one of the audiologists that came, and through hearing the call and in Theos, we have an audiologist who is training right now in Malawi, who could not have had that opportunity because technically she's known as a Child Without Borders. These are survivors of the genocide from Rwanda who have happened to find themselves in Zambia, especially the children. And one of them found herself in my constituency, in my village. And today she is about to complete as an audiologist, Jen, and will be coming back to Zambia to save the people of Zambia. So you can imagine that this partnership is so overreaching, and the future, only us can try our best now, but the future is huge. So what do I see for the future? I see a situation where we can begin to think of, what about a university or a college like we saw in Malawi, where technicians can train and maybe one day become audiologists themselves. Or we can have more technicians, not only in the capital city, but also in the rural areas, because the need is there, the need is great, but we don't have the hands and the feet. In the meantime, I also see a continuation of this partnership with Hearing the Call, so that some of your technical expertise can begin to be transferred for the time that you are there with the people that are on the ground. We have people like Dr. Hapunda, who is one of those audiologists who has given her life, given her support to hearing the call. You have audiologists in Kabwe and other places, not audiologists, but technicians who are coming alongside. We have a place like Hope Village, a place where orphans have been learning, and now they are willing to use some of their land to help a school start for audiologists. These are some of the future possibilities that I see, but all it will take, it is equal partnership on both ends to bring your expertise and what you know best, and for the people of Zambia to bring what they have and what they can offer. Together, we can pull in the better direction and make the future, especially for children, be much more a reality. Lastly, but not the least, we built a hospital through an organization that I started by the name of Fountain of Life Africa. And it is the organization that has been spearheading the teams and the people that have come to Zambia. Just last year, in October, the President of the Republic of Zambia, President Hakainde Hichilema, who has been rated as one of the 5 outstanding presidents in Africa, actually, just commissioned that hospital, which some of the people from hearing the call donated to funds to build that hospital. Today, it's being run by a religious organization, which we believe is very much excited to see a possibility of a continued clinic with hearing the call. So these are just a few things about Zambia, and 10 years looking back, I get goosebumps to watch the video that Jim was able to show us, the many different countries that now hearing the call is in. So I wish I could say more, but I'd rather see you on the African soil in Zambia, welcome you, greet you, and say, welcome, Twalumba, Kwamitambula, Zikomo, Kwatotela, until we meet in Zambia. I hope that these few words have encouraged you, have expanded your understanding, and know that the people of Zambia, on behalf of my own people in Chivombo, in Zambia, and indeed on behalf of the President of the Republic of Zambia, we are grateful for you, because we realize as a country, as a nation, we cannot do it alone, and your support cannot be underestimated. We thank you, and we hope to see you in Zambia, but if not, wherever your heart will lead you on one of these hearing the call mission. Thank you very much.
Thank you, Princess. We greatly appreciate your time and being able to come here and share today with everybody. These trips, as she was saying, are truly life-changing. They're an opportunity to almost get back to your roots and maybe discover why you fell in love with audiology to begin with. So it's something that we hope you consider and sign up for a trip or contact us for more information. At this time, I'd like to introduce the founder and chair of the board of Hearing the Call, our fearless leader, Nora Stewart. Nora, if you'd like to.
Nora, you're on
Yes,
mute. Perfect.
unmute. Yeah. Thank you, Jim. Thank you, Princess. I can't believe it's been 10 years since we first met. Princess is a huge part of the inspiration of why we founded Hearing the Call. Going back to the day when I heard Princess talk about the plight of the orphans and HIV, she started talking about 3 minutes in. There weren't enough tissues around me to wipe my eyes, because she's such a powerful influence, making Zambia a better place for everybody. I couldn't help but think, how do we get behind her? How do we do what we can do? We can't do what Princess can do, but we can do audiology. And we know audiology completely changes lives, especially like Princess said, with children, when they have no other means for an education because they can't go to school because they're not hearing. So 10 years seems like a flash, but I can't wait for the next 10 years because, like Princess said, the work doesn't just stop when we go for a week and we treat people with hearing loss. The work continues because we really believe in partnering with people on the ground like Princess and like Village of Hope to build a university audiology program and to build a school for the children that we fit with hearing aids. So we know that they are getting the exact kind of education that they can go and succeed in life. So whether come on a trip with us or support Hearing the Call to support some of the scholarships that are happening for additional training for people in Zambia, we welcome everybody to this journey who's in audiology because you won't believe the amount of impact that just a few of us can have if we pick up and go, get out of our comfort zone and get behind Princess and our other partners around the world. The best part of this is meeting the world changers like Princess. We go because we think we're going to go change lives, but like Mary Thorpe said, it's us that get changed the most. So please, anybody, if you have an inkling to come, Jim is going to share what the schedule is for the rest of the year. And we have plenty of trips going out to 2025 if 2024 is too soon for you to make plans. But you can always find this on Hearing the Call website, which is hearingthecall.org. And even if you're just interested, sign up. Let us know of your interest and we'll reach out to you with a lot of additional information to join us. So thank you.
Thank you so much, Nora. I appreciate that. Thanks for sharing that, Jim. Feel free to leave that slide up if you want, or it looks like Jim just put a link in the chat, which is great. I'd like to encourage anyone who has any questions that they have not yet asked to go ahead and do that now in the Q&A at the bottom. And I have a couple questions that have already been asked here, so I am going to go ahead and get started with those. So the first one here is, and I don't know if Nora or Jim would be better at answering this, I'll let you guys decide, but how do you select the destinations for the trips or the countries that you're going to go to?
Well, I can take that. It's as simple as we find a good partner because it all is based on who's on the ground in that country. So we have a lot of people reach out to us saying there's a need and can you come? But it really depends on what's the support in the country and what are their connections. For instance, Princess is now in Parliament, so she is, connected us with government and with other nonprofits. So it really depends on the strength of the partner.
Okay, great. Hey, Jim, we've got some requests here for the QR code again. I see that we put the link in the chat, but are you able to share that again? And then I'll just let everybody know as well that we'll be sending an email in follow up to this where we'll provide the recording. We'll also make sure to include this link in that email as well so that you'll have it there. So great. Okay. Another question here is, what sorts of things are you doing clinically on the trips? Can you talk a little bit more about what types of audiology services you're providing and what sort of skills anybody who's going to go might need?
Yeah.
Would you like me to take that?
That would be great. Thank you, Mary.
So we take all our equipment with us. We use kudu waves and we have OAE screeners and tympanometers. We bring real-ears with us. We bring the Medrest real-ears. So, we try our very best to follow best practices while we're there because we want to ensure that we're doing things properly. We do training also to people in their communities to help troubleshoot before the next trip is there. So audiologically, just about anything you would do in your own practice, we also do on these trips. And it's a huge endeavor to get all that equipment to all the different countries, but we definitely do it thanks to the Entheos staff that is amazing at getting all of this put together for all of us, as well as supplies, etc., for doing that. So if you have any questions about anything else, just let me know when it comes to the audiology side of it.
Great. Thank you, Mary.
Chelsea, can I just add also that when the hearing the core team has left, using Zambia as an example, there is a staff or some other volunteers and other local people like Dr. Hapunda, who ensures that there is a continuation of checking on those that may need support or batteries changed or any other services while the team leave for the US. So it is important to underscore that, because the question can be overwhelming. We have done this, but what next? Because you may only be back to Zambia the next year. And that is why having a university in mind, the next 10 years as we plan, is very critical, but also ensuring that we have connected with other expertise on the Zambian ground who are able to continue with those basics follow-up when the team has left. So the clients or the patients are not left, almost like left out until the next time. So I thought I'd add that.
Great. Thank you. Okay. Another question here is, can hearing instrument specialists participate, or do you have to be an audiologist?
Yes, hearing instrument specialists can absolutely participate. And one of the best parts, and not the best part, I mean, one of the phenomenal parts of the trips is it's really hands-on, working side by side with other professionals. And I can't stress enough that it's a judgment-free zone. So everybody is welcome. And it's when you come out of your comfort zone and you get placed in an area in a clinic that you have a makeshift. I mean, we've literally made clinics under trees before. It's amazing the kind of partnership, no matter who you're working with, and the mutuality of working together and learning from each other. I've never had an audiologist or hearing instrument specialist leave saying they didn't learn something new from somebody that they worked with. So it's really sharing clinical best practices is a highlight of the trips.
Great. Thanks, Nora. And then a quick follow-up here that's related to that question is, what about audiology assistants?
Yep, we love having audiology assistants too. All are welcome.
Okay.
And I
Excellent.
can think of one more. There's a few trips where the countries we visit speak a different language than English, as you can imagine, and we are often short on translators. So we've been talking about hearing healthcare so far, but we need translators. So if there's somebody that a family member, they're fluent in Spanish, they're fluent in a few different languages that we travel to, we need their help too. So please certainly contact us about that, and we welcome them on our trip.
Great. Okay, I have a question here. This person's saying they're not sure they would be able to actually go on a trip, and so they're wondering if there are other ways to support this mission if they're not able to travel in the near future.
Yeah, absolutely. Like Princess talked about, the support that happens after we leave. For instance, in Zambia, we do support a technician that goes out. So that's all by the kindness of donations from people that we truly do support a position that is going to continue the care after the team leaves. And also for scholarships, like Princess mentioned, we have a young woman named Jane who is finishing up her audiology degree in Malawi. And so any kind of donation towards us, if you are interested in supporting scholarships or technicians in the area in country, you would go on to Hearing the Call and can support with just monetarily. And we truly, truly appreciate that.
Excellent. Okay, that is the last of the, of course, I just got another one. Oh, great question here. Where do the hearing aids come from that are used to fit the patients?
Wow, from everywhere, really. We have manufacturers donate. We raise money that we purchase hearing aids from the different manufacturers. And we even have relationships over in the UK where with their system, people are allowed to get new hearing aids, I believe every 3 or 4 years. So they have buckets of gently used hearing aids that they donate to us for the cause. So really, we get them from anywhere we can. And we're just making a big push. If you want to donate gently used hearing aids to us, we will gladly accept them from your clinics too.
Great. Thanks, Nora.
Chelsea, maybe just to add, um, this is for those who are hearing, and I can be corrected, Jim, is how you are able to make is it hearing modes on the sites? And that has really been amazing because you're able to modify them accordingly to the client or the patient that has come. And maybe, I don't know whether it's Nora or Jim who can speak to that, because that has really brought a lot of excitement. I remember one grandmother who brought a child in one of the clinics they did in Zambia at Sompola, and the baby or the child, well, she wasn't a baby, maybe, I don't know, 4 years, 5 years, was able to be fitted right perfectly because the team for hearing the call were able to make these hearing modes right there on the ground. And it's like a miracle happening while you watch, and maybe someone can speak to that. But that has been something that has sent a lot of people, when they hear that these clinics are coming, the teams are coming, it's overwhelming. Usually you have to go back the next day because of just the outcome, the overwhelmingness of how many people come, because they know they'll receive the proper but also tailored hearing modes according to their needs.
Yeah, thank you, Princess. And the big thing about those ear molds is we always have audiologists or hearing instrument specialists get the actual mold, but that's another volunteer position. So we have lots of significant others that it's like a craft that we can teach how to bore and tube the ear molds. So again, like who can come? It's not just audiologists and hearing instrument specialists and audiology assistants. It's truly significant others and family if you want to bring them along to see the impact of audiology on a community. And the ear molds is one way. It's a really great job that volunteers can do.
That's great. I love that. Okay, I have another question here. This person says, I saw in your video, United States. So I'll maybe have, anybody can answer this, but in your video, Jim, what are the opportunities, if you're not, able to travel internationally?
Excellent. I think that is a great question, because when COVID hit, our volunteer audiologists were distraught. They could not return to these countries to help the hearing healthcare continue. And so the perspective turned inwards about, well, what can we do in the United States? And at the time, we were probably in partnership with about 10 private practice audiologists around the country, where they offered their services to income eligible patients. And as of COVID, that number ballooned. Now we're in 19 states with 36 different private practices. And what these private practices do themselves is they specifically open their door to income eligible patients, and they can do that through our tax deductible fundraising platform. But COVID led them to start to have events. So they realized, well, we can also do what we do internationally here in the United States. Yeah. And so occasionally these events are so big that volunteers are welcome. Sometimes these events have 3 to 6 patients where there isn't a role for a volunteer, but sometimes these events have 20 to 40 patients in a single day. And so we absolutely need volunteers. So if you like the idea about volunteering at a national event, I invite you to contact us. You can send us an email. It'd be best to info@hearingthecall.org if you have a volunteer request and would like more information about volunteering in the United States. These are wonderful opportunities. Sometimes local media picks up the coverage on them that helps spread the word and awareness. And it's just really great that so many, private practices are opening their doors to everyone. And at Hearing the Call, I want to highlight that we go 250% over federal poverty level. So in 2024, that's $79,000 a year for a family of 4. That's qualified. And so we really want to make sure that we're reaching what we consider to be the gap patients, people that maybe don't make enough for the cost of hearing aids, but make too much for government assistance. So I hope that answers the question. But yeah, we welcome your opportunities to volunteer both nationally and internationally.
Great. Thanks so much, Jim. I think I'm done answering the questions. If anyone has one, feel free to pop it in right now. Like I said, we'll make ourselves available with a follow-up email too with this recording and ways to get in touch and ask additional questions or get started in the process about learning more. So I just want to thank everyone so much for giving us their time today. Really appreciate you all. And hopefully this is just the beginning of your venture into humanitarian audiology. So thank you so much to the Hearing the Call team. Thank you, Princess. Thanks everyone for attending, and I hope you have a wonderful rest of your day. Talk soon.